Okay, welcome everyone to our information session for our Healthy Food Access Community Grant. My name is Alicia Duquara. I'm the Executive Director at Get Healthy Utah, and I'll be presenting, going back and forth with Emma Andreessen, who is our new program coordinator over our Healthy Utah Community Program designation. So our goal today will kind of give some background why we're doing this grant, share our excitement with you for doing this grant. And then we'll talk about some of the details for the application and then hopefully open it up for we will open up for questions. If you have to jump off, if there's still more questions, you can jump off when you need to jump off. But this is being recorded, so we'll also have this uploaded to the website as well. Our application for this grant is on our website, so I just threw that in the chat, and you can follow along and look at that application as we talk about the details. So first, we're just really excited. We're so excited to have this opportunity again. Get Healthy Utah has done community mini grants in the past, but it's been about 2 years since our last grant because we've had fluctuations and changes in our funding. And so we've been trying to get our funding stable and back to be able to offer these opportunities for our communities across Utah. And we opened up a new corporate sponsorship program this year and are able to already secure a few corporate sponsors and open up this opportunity. So we want to give a huge shout out and gratitude for our sponsors to make this opportunity possible, which is AARP Utah, DMBA, and University of Utah Health Plans. So grateful for their support and partnership and excited. We're hoping this is one of many future opportunities that will start opening up again for our Utah communities to work on improving health. And we did get a grant that will be coming late spring, summer for Social Connection. So we do know that is another opportunity that's going to open up in the next 6 months, another community grant opportunity to work on social connection. So if you're excited about social connection strategies, you'll look forward to that as well. So again, very excited to have this opportunity to work with our cities and towns on these projects. So hopefully most of you are familiar with the Healthy Utah Community designation. If not, you can go to our website and learn more. This is a designation program for Utah cities and towns to work on improving community health on our 3 focus areas, which is physical activity, healthy food access, and mental well-being. So this community grant will focus on that healthy food access piece of our designation. If you are not a city or town, but a partner or school, you can look at this list and see who is designated and who you could potentially connect with and partner with on a project. If you are not a designated community, you are still able to apply, but priority is going to be given to communities that have shown their commitment to work on these different strategies by getting that designation. But we do know some of our smaller towns maybe not having capacity and needing a grant like this just to be able to qualify is important. So again, not a requirement, but definitely a priority for those communities that have the designation. So with that, I'm going to kick it over to Emma to kind of talk about the background about healthy food access. We did a survey a couple years ago with cities and towns, and this was the hardest area for cities and towns to work on because we don't have staff in a city that really works on healthy food access. And we do have our Parks and Rec staff that will do physical activity. So this piece of the designation has been a little trickier for our communities to work on. So that's why we been excited to do our last annual event about this topic and then be able to open up this opportunity. So I'm going to kick it over to Emma to talk a little bit about that.
Great. Well, hi, everyone. Like Alicia said, I'm Emma and I'm the new program coordinator. And I'll be doing a brief overview on why healthy food access matters. And I'm sure we all know that, so that's why we're here. But it's very surprising to see that the CDC estimates that only about 12% of adults are meeting the minimum requirement for fruit intake in a day, and only about 8% are meeting that minimum vegetable recommendation. And it's even more surprising that for teenagers across the country, only about 7% are meeting that daily fruit minimum recommendation, and 2% are meeting the vegetable recommendation. And this is concerning because the lack of nutritional, healthy, and fresh foods, paired with the higher consumption of processed foods and sugary drinks, it puts people at a higher risk of experiencing these chronic conditions later down the line. And we want people to live healthy and happy lives. So if we can prevent that early on, we'd like to. And then a lot of people think that healthy food consumption relies entirely on the individual because we are choosing what to put into our bodies. And while there is some truth to that, the social determinants of health, and namely the built environment, do play a big role in who has access to what types of food. And at Get Healthy Utah, we like to create this culture of health, and we're trying to change attitudes at the city and town level about the role that they play for the health of their residents. And so planners and developers can choose where different food retailers go in a community. Some more affluent areas might have a retailer like Harmon's or Trader Joe's that has access to and has the availability of healthy food, while in a lower income area, they may have more fast food options or convenience stores that have prepackaged processed foods. And in that same vein, land use also plays a huge role in where food retailers can go. In most places in Salt Lake City, we have segregated uses in our zoning. So residences are kind of over here, and then commercial areas are separate from that. And so you need reliable transportation to get between your residence or your work and a food retailer. And for those who don't have access to convenient, reliable transportation or their own personal motor vehicle, it can be really challenging to get to places that have fresh, healthy food. And so, for people who may not have access to a car, it's important that we have the public transit infrastructure or the active transportation infrastructure to help them get to that food retailer. And we want people to be safe while they're doing so. And then finally, planners and developers can preserve open spaces for community gardens or edible parks or things like that. So overall, planners, developers, and cities at large play a big role in placing different food retailers. Next slide, please. And then finally, the Utah Foundation released this report on cultivating food accessibility in 2023. And it had a lot of interesting findings, but some of the more important ones for our purposes are that almost 11% of Utahns are food insecure. And this number can fluctuate depending on different demographic factors, such as age, racial or ethnic minorities, or income. And so they found that to provide better food access requires a interdisciplinary approach. And so we need a variety of sectors working together. And some of those strategies they found that could work to alleviate poor food access is farmers markets, community sustained agriculture, and community gardens can help make food more accessible. But we also need that affordability piece. And so that comes in with more income targeted programs. And then with that, they also found that empowering convenience stores with knowledge and resources about providing healthy food can increase food security in lower income areas or in food deserts. And then finally, they also found that food waste diversion programs and local food pantries can help alleviate food insecurity as well.
Awesome. Thank you, Emma. So I will kind of go into that's kind of the background, why we're here, why we're excited, and some, things to get you thinking about potential projects you can work on. So I'm going to spend a few slides talking about some of the details, project expectations, eligibility, how to apply, and then we'll end with a few more examples, some pictures of what cities and towns have already done in the past with the designation or other projects they've done to get you, again, thinking about all the possibilities of what you can work on in your communities. So for project expectations, again, all of this is outlined in the application that you can find on our website at that link. I don't know if it pins the link. I'll put it in there one more time for those that joined, maybe after I sent that. So these are all outlined in the application. So I'll kind of go through some of those different pieces. So first, we're expecting, you to have some type of project team or to work on the project through your health coalition if you have an existing health coalition. And there's a question on this. And so Get Healthy Utah, again, as Emma mentioned, we're so big on cross-sector collaboration, working together across the different sectors, working between our cities and our schools and our health departments and our nonprofits across transportation and planning and all of our different planners and or partners. So there is a question on the application just describing, who's going to be involved in your project, what partners are going to be on your team, and how are you going to kind of work together in the role of different partners. So explaining that. And then we're really excited about this healthy food walk audit. We've been piloting this walk audit project in Price City, Utah, the past 9 months through another grant. And this again is something that we're trying to get our cities and our partners to be more informed about what are the data sets that you can look at to understand your food access. And then what are some different tools or exercises you can do to really assess, what does food access look like in your community? So for this conducting a healthy food assessment and walk audit, we are finishing up a how-to document that the awarded communities will receive. So you don't have to start from scratch. You're like, what is this? What are we supposed to do? We will have a how-to document. We'll have the actual tool, the walk audit tool that we did pilot in Price. And then all the different resources for you to do this assessment and do the walk audit. You'll decide, what route you want to do. If you can involve residents, awesome. What partners you can do. And this will kind of further our knowledge of what's working well when we do these walk audits, and you can kind of share lessons learned as you do this piece. So it shouldn't be a super heavy lift. Again, we'll provide the how-to document, and then we'll have a worksheet that you'll fill out, kind of some of your findings as you went through that assessment and walk audit process. So that will be a fun thing for us to do with our awarded communities. And then we'll offer a few learning sessions. We'll have a kickoff meeting that kind of goes into the walk audit piece, some of those tools, and then based on the community's projects of what we award, we will bring in partners, different mentors, and resources specific to those different strategies to do some learning sessions. So we'll look forward to that based on the projects that we choose. For the application, we ask that you implement at least one health strategy, but if you have a couple, if you're pairing, community garden with some education piece through another different type of partner, describe your strategy, describe all the different components that you're wanting to work on for this community grant. And then we will ask for a final report at the end of the project. We'll provide a template for that, but we'll ask, about data that you collected through the project. Pictures, we love pictures, success stories, lessons learned as you went through this process with us. So what will communities receive? Again, this community grant is up to $2,000. We have a budget piece at the end of the application that you will fill out, write down the different line items about how much it will cost to submit your budget for the project. That doesn't mean it has to be $2,000. If you only need $1,000, and you can submit a project for $1,000 and we can award more communities. So again, any of the level of funding up to $2,000, fill out that budget piece and just describe as much detail as you can what your funding will go to. As I mentioned, you will participate in these learning collaborative, the learning sessions. Again, we're hoping to provide that mentorship, technical assistant, resource, expertise from people that are already working in this space, other communities that you can partner with as well. So we don't want to just leave you on your own to do it. We really want to provide that learning network and resources as you get into your projects. And then we know one size doesn't fit all. We know that our local communities all have different frameworks, infrastructure, assets, barriers, opportunities, partners. And so we really want you to be able to fit what your local needs are. So give us as much detail in your application of what you're wanting to do with this funding, what your strategy will look like. But as you get into maybe the walk audit, doing some assessment pieces, if you find, oh, we should tweak this or that based on some of the assessment, we're open to that flexibility throughout that project period if you need to make some changes. And then next steps and how to apply. Again, we've gotten a lot of questions and emails already on who would be eligible to apply for this funding. Our priority target audience for this funding is our Utah cities and towns because this is connected to that Healthy Utah Community Designation Framework. So again, this is our carrot that we have for cities and towns to be designated is to be able to apply for these opportunities. So that's kind of our primary audience is our cities and towns to apply. But that does not mean other organizations cannot partner with our cities and towns on a project. So if you're a school and you want to do a school garden for your students and maybe open it up to the community, then reach out to your city and say, hey, we would love to do a strategy that's going to impact our students and maybe our community by opening up this new school garden, and connect with the city and kind of talk about what the role the city can play and how you can work on it together. If you're a nonprofit already offering some type of program that helps improve healthy food access, then we would ask you to identify what community or city that you would like to partner with and do that strategy in their specific area, and what, again, role will the city play. So we're trying to have the city be that backbone organization that's being able to work on these strategies with partners through the designation. So if you are having the city apply, we don't need any type of documentation other than what partners they're partnering with. But if you're applying and you're not a city and town applying, then we will ask for some type of letter of support or MOU or something saying, hey, we are working with the city and town on this project. Here's their role and how they'll be involved so that we can still tie it back to that healthy community designation. So there might be more questions on that at the end, which I'm happy to answer. But that's kind of how we look at these projects and who we're offering it to. As I mentioned at the beginning, priority will be given to those communities that do have that Healthy Utah Community designation. You can still apply if you don't, but we will look at that. And then because our biggest sponsor of this project is AARP Utah, we are also going to give priority to projects that will benefit older adults. So AARP Utah has an age-friendly network where they're trying to help cities and towns and counties embed a aging lens to their work and how you can always consider or benefit older adults to make sure that things are more accessible. So with that example of community garden, if you have a community garden as your strategy, if you just include, hey, we're going to put in some raised beds that are ADA accessible for our older adults that might be in wheelchairs or other residents that might be in wheelchairs, or hey, we're going to have some type of transportation piece from a local senior center to get to the community garden. So there's that accessibility. If you just want to add some pieces like that to your strategy that will benefit older adults, that will help raise the priority of your application as well. And then finally, key dates, we have applications due Friday, March 13th by the end of the day, by midnight. We don't really have a time, but by the end of March 13th, that following Monday, we'll start screening and scoring the applications and then hope to have agreements drafted and sent out and getting projects started by April 1st. And then the project, we forgot to put, it runs through January, the end of January. So we're trying to do it with the planting season for those that want to do community gardens or seed exchanges or produce sharing. So we're trying to get this right when the planting season's getting going. And then you'll kind of work on the project throughout the end of the planting season and then work on your final reports and evaluation and everything to turn in by January of next year. So to apply, you will just download the Google Doc, Word document, fill it out, and then email it to our info@gethealthyutah.org. So to end, I'm going to kick it back over to Emma again to just share what have our other cities and towns done in this space that can give you some more ideas of what you can work on.
Yeah, so the opportunities are truly limitless. And just to reiterate, we do want this to be tailored to the specific needs of your community, and each community is different. So it'd be important to kind of look at where that accessibility is limited and how you can potentially alleviate that. But some potential products that our cities and towns have done in the past are farmers markets, mobile markets, or food box programs, which that food box you can see in that middle picture. Again, a lot of people like to do community or school gardens. You can add or expand SNAP and EBT or double up food box access. You can look at transportation solutions to safely get active transportation users to food retailers or to improve public transit. You could also look at policy changes to add things like backyard poultry or animal husbandry. And then you can also do culturally relevant food access initiatives. Like Alicia mentioned a few minutes ago, we're currently working on a product and price, looking at where to potentially put a Hispanic market because The Latino population in the area has to drive to Utah County to access their culturally relevant food. And you can also do educational programs like healthy cooking classes or gardening programs. So we have a few cities that we want to highlight that are doing exciting things. So in Moab, they partner with the Youth Garden Project, which is a nonprofit that runs a community garden project and they grow organic foods, but then they also have that educational piece. So they host cooking classes and they offer support for local youth who may be interested in learning how to garden. Next slide, please. In Smithfield, they're doing a produce sharing stand. So I know I'm guilty of not getting through my produce sometimes without it going bad first. So for residents who might overbuy, they can put it into this sharing stand and it's free for communities to stop by and take some produce, which is really great. And then finally, Summit County has a few cities that are doing seed libraries in their library branches, and it kind of operates like a regular library. You can borrow seeds, and then once your produce grows, you can take the seeds out of that and put it back into the seed library for the next person to use. So finally, we work with a lot of really excellent healthy food access partners at the state level, nonprofits, and other organizations. So I'm sure that if you're curious on how to get started with any of these projects, these partners would be willing to offer support and guidance throughout the grant. So. With that, I believe that's the end. So thank you so much for listening, and I think we'll open it up for questions now.
Awesome. Thank you, Emma. I'm going to go back to that partner slide real quick. I do know that some partners have reached out wanting to work with communities. So if you are one of these partners, if you want to add your contact information in the chat and a little bit about what you work on, we can help kind of facilitate some of the collaboration opportunities in the chat here today. And then if you do have questions about these partners or they're not on today's call, if you want to reach out to us at Get Healthy Utah, we can also connect you as well. So we do have a lot of great nonprofits and state agencies that are doing a lot of great work that you can use their resources and bring it to your community as well. So partners, feel free to add information in the chat. Okay. And then again, you can get all our information on our website. That funding opportunity is posted to our website as well. And you can also email us at our info@gethealthyutah.org. If you can put our email in the chat real quick, the info at email, since I didn't put it on this last slide. But you guys can email us as well. So I know we have a couple questions in the chat, so you're welcome to add your questions to the chat. And then you can also come off mute or raise your hand and come off mute as we wrap things up. So I'll start with the questions in the chat. I saw Julia ask, can you give some detail on how adding or expanding SNAP or EBT and double up food bank access component is awarded and used by constituents? So this is getting at with our farmers markets, trying to open up access to all community members. And so there are a few programs that you're able to use some SNAP monies, EBT monies to purchase at farmers market if that farmers market is set up to accept it. So we do have some farmers markets that are set up that community members can use these monies to purchase produce from a farmers market and some that do not. And so if you look at your farmers markets that you offer in your community and you see that that isn't an option to use EBT SNAP monies, or have the Double Up Food Bucks program, which I need to make sure we still have. I know that one's kind of been up and down with federally, if that's still available. If someone's on the call and knows that, you can add that in the chat. But it's a matter of like buying a certain machine that costs a certain amount of money to have that machine to be able to accept the SNAP EBT and kind of building the infrastructure and technology piece to be able to accept those at the farmers market. So that's kind of where the funding component comes in and how it's used by communities to make sure there's access for members to use that at a farmers market. So, Julie, I hope if that doesn't answer your question completely, you can come off mute. Hopefully, that gives more detail. And then let's see, the next one, foster, could these funds be used for senior centers who provide free or reduced lunches for seniors? Um, so I guess it's if you're asking, can the monies be used to purchase meals? That one might be, we're looking at strategies that can be sustainable. So if you're using your funding like for one time, just purchasing food for seniors or for an event, that might not be scored as high as kind of more sustainable, like a process. So if you're trying to embed a certain process or things into the senior center or educational component that you can sustain, we probably would look at that more than just a one-time use of purchasing meals. Um, yeah, let me know if you have further questions on that. Let's see. Cynthia, if we expand our community garden to add more beds, raise an ADA accessible or fruit trees. Yes. So if you do have an existing infrastructure, but you want to expand or improve it with this funding, that is a good use of this funding. So if you do already have a community garden, but you don't have those raised beds or maybe a path to get things, or yeah, want to add in some fruit trees, that would be a great project to improve or expand something that you already have in your community. So again, kind of going back to that, yeah, how are you using this funding? We love seeing strategies that are can be sustained, or by making this improvement this one time, you're able to increase the capacity for years to come versus just like a one time, we're going to use it for this one time piece and it's not going to be sustained. So we'll definitely look at that sustainability component with what you're offering. Okay, I think those are all the questions in the chat. Are there any other questions or comments? Either you can come off mute or add to the chat. Okay, looks like everyone's okay. Is there a list of SNAP and EBT farmers markets anywhere? Julie again. Yes. I will need Utah's Against Hunger website might have it. Julie, if you could put your email in the chat, we can send you some information. And then Emma, if you can grab Julie's email and we can follow up with that as well. Thank you all for joining us for this information session. If other questions come up as you're looking at the application, feel free to reach out again to our info at email. We're happy to answer any questions in the meantime to help you have a strong application. And again, thank you for your interest and for wanting to improve healthy food access across Utah. Again, this will be recorded and we'll upload it to our website and send it out in an email to all our registrants, and look forward to seeing all the wonderful ideas and applications that you will be sending in. Have a good rest of your Wednesday and healthy habits always. Bye.